doing today?
Good.
Good. My name is Karina. I'm going to be your student nurse today.
Okay.
I'm going to do a full head to toe assessment, so just looking over the major parts of the body, make sure they're functioning. Does that sound good?
Mm-hmm.
Okay. Can I get your name and ID, please? Your date of birth?
Felicia Sullivan, 4594.
Okay, perfect. I'm going to close the curtain, ensure privacy. I'm ensuring safety for my client. Not going to share any information they don't want me to share. Performing hand hygiene. Okay, before we begin, do you have any pain today on a scale of 0 to 10, with 10 being the worst pain you've ever felt?
I'd say 0.
Say 0?
Mm-hmm.
Okay. So what I'm going to do is just kind of like touch your face, test the strength in your extremities, and look for pulses. Make sure that they're all functioning and working well.
Okay.
Ready? So I'm testing the general appearance. She looks well relaxed. Her face is nice and even. She has a good mood. She's content. There's no obvious physical deformities. She looks clean, well nourished, hydrated. She's well articulated. English is her native language. And this is kind of a stupid question, but do you know what year it is?
2018.
2019. Do you know who the president is?
President Trump.
Okay. And where are you right now?
I'm at MNU.
Okay. My patient is alert and oriented ×4. Okay. I'm going to look at her scalp. She has nice hair distribution. I'm palpating for any lumps. Tenderness. Are you having any tenderness?
No.
Okay. No incredible dandruff, no lice. Nice, full, healthy hair. Normocephalic head shape. Okay. I'll be assessing the skin on all parts of the assessment. So skin looks nice and healthy. It looks hydrated. I'm going to touch it. My hands are a little cold. It's warm, dry, intact. Can I see your hands, please? Okay. Fingernails look clean. She's wearing appropriate clothing for the season. I just pinched her nail, and her cap refill was less than 3 seconds, so she is well hydrated, and there's good capillary refill. I'm going to test skin turgor by pinching right here on the bony prominence. There's no tenting. Again, hydrated. Okay, so I'm going to be looking at her eyes now. Can you pull down your conjunctiva? Okay, good. So she has moist pink conjunctiva, and I'm looking at her eyes. I see the sclera are white. No yellowing or bloodiness. Her pupils are a nice greenish blue-gray. They're even colored. Everything is symmetrical. Her pupils are about 4 millimeters dilated right now. Okay. I'm going to do a few eye tests. So I'm going to do a corneal light reflex. I'm going to shine this light. Look at my nose. Okay. The light was in the same spot in both eyes. So that is good. Her eyes are not moving in opposite directions. And follow my finger. Going to go to her nose. And look at the wall behind me. Her pupils dilated on that. So cranial nerve 2 is intact. She has good visual acuity. And follow my finger again. 6 cardinal fields of gaze. I'm looking for any nystagmus, any shaking of the eye. I don't see any. And so she has good ocular movement, so cranial nerves 3, 4, and 6 are all intact. Now, I'm going to check for accommodation. So just look at my nose. Both pupils constricted. And now I'm going to go on to the ears. So turn your head for me. Okay, her ears look nice, symmetrical. She has a piercing in both ears, has a few freckles. I didn't see any discharge or cerumen buildup. Look nice and healthy. And I'm going to go behind her and do a whisper test. So I'm just going to say like some words and numbers behind you, and you're going to point to the ear you hear it in and tell me what you heard, okay?
Okay.
Kittens and puppies.
Kittens and puppies in my right ear.
Okay.
425 in my left ear.
Okay, good. Hearing is intact. That's cranial nerve 8. Okay, so the nose is symmetrical right now. Can you just occlude one nostril and blow in and out for me, just gently? And the other one? Okay, and there was no congestion?
Nope.
Okay, her nose is patent. She has a clear airway. I'm looking at her lips. They seem well hydrated. Can you smile for me? Okay. And open your mouth real wide. Okay, stick out your tongue. Cranial nerve 12 is intact. She's able to stick out her tongue. And just smile again. Okay, her teeth are white. There's no chipping or discoloration. Her gums are nice and pink. They're healthy and open real wide again. Her mucosa is pink and moist. It's hydrated. And say ah.
Ah.
Okay, cranial nerves 9 and 10 are intact. And her uvula went up midline, so she has a gag reflex. I don't need to pursue that any further. And then I'm going to test range of motion. So can you look all the way up for me? And down. And then center, side to side. Okay, and then try to touch your ear to your shoulder on each side. Okay, press against my hand. And again. Okay, and shrug your shoulders. Okay. So cranial nerve 11 is intact for movement, and she has a 5 out of 5 on strength. And raise your eyebrows. Okay, smile, frown, and puff out your cheeks. Okay, the cranial nerve 7 is intact. I'm going to check for sense of perception. So I have this pokey object and this soft object.
Okay.
You're going to close your eyes, and I'm going to put one of these on a part of your face. You're going to tell me if it's pokey or soft, and then where you felt it, okay?
Okay.
So close your eyes.
Pokey on my left cheek.
Okay.
Soft on my right forehead.
Okay.
Soft on my left forehead. Pokey on my right cheek. Pokey on my left chin. Soft on my right chin.
Okay. So cranial nerve 5 is intact. She has sensation to touch and pain in all of her face. I'm going to move down to the shoulders. They look symmetrical. They're rounded. Okay. I'm going to check her radial pulses right now. So I'm just going to feel there. +2 bilaterally. Okay. Check for strength. So hold your arms like this. I'm going to press down. Resist me. Okay. Flip them over. Resist me. Okay. And then squeeze my fingers. Okay. Strength is +5 bilaterally. Let me check your carotids right now. Not at the same time. Okay, +2 bilaterally in the neck. I'm going to palpate as well. Palpate her head and the frontal sinus and the maxillary sinus. Was there any tenderness there?
Nope.
Okay, there was no lumps present. I'm going to test out her temporomandibular joint, so just open your mouth real wide and close it. Okay, the joint motion was smooth and there was no crepitus present. And I'm going to palpate the lymph nodes. So the preauricular, the postauricular, the occipital, and the submandibular. Okay, and was there any tenderness?
No.
No tenderness. There was no lumps on palpation. It's clear. Okay, so now I'm going to move to the posterior chest. Okay, she would have her shirt off and I would be looking at her skin, so I'm looking for any moles, lesions, anything suspicious. She's standing upright. She has a nice ovoid shape to her thoracic cage. Her spine has a nice curvature to it. I'm palpating, looking for any bumps. Okay, I don't feel any bumps. You can lean forward just a little bit and tuck your head down. I'm going to palpate the spinous process. Make sure that there's no protrusions and that it's straight midline. Okay, it appears straight. You can sit back up. I'm going to put my thumbs, my hands, right back here on the back. Breathe out and then big in. Okay, my thumbs move symmetrically. There's a good expansion of the chest. I'm going to percuss the costovertebral angle. Was there any pain?
No.
Okay. Any pain there?
Nope.
Okay, There's no kidney inflammation in that area. So I'm going to move on to auscultation of the lungs. So I'm going to start at the tops and move side to side all the way down, and then right laterally so I can listen to that middle lobe. So breathe in for me nice and big through your mouth. And then the right middle lobe. Okay, there was no crackling, no wheezing, no adventitious breath sounds. Clear to auscultation. Okay, you can go ahead and sit up. And I'm going to look at the anterior chest. So I'm looking at her skin. I'm looking for any marks. I'm watching her breaths and making sure she's not using any accessory muscles right now. She seems to be fine, no labor breathing. I don't see any scars, no dry skin, or her skin is dry, but it's not cracked. No lumps, I'm palpating. Is there any tenderness?
No.
Okay. Okay. I'm going to auscultate again in the same fashion, just side to side and down. So breathe in. And if you get dizzy, let me know. We can slow down. Okay, lungs are clear to auscultation. There's no crackling or wheezing. Now I'm going to assess the heart, so I'm going to have you lean forward a little bit. And with the stethoscope turned to the bell, I'm going to listen to the aortic. So breathe in for me and out. Okay, it's clear, there's no murmurs present. And she has a good normal sinus rhythm. So now I'm going to flip it back to the diaphragm, and I'm going to test in the 5 spots to listen for all of the heart beats. So I'm going to start again in the aorta. I hear nice S1 and S2, normal sinus rhythm. I'm going to move over, down, down again, the Z pattern. Okay, I'm going to palpitate for the apical pulse and the left mid-clavicular line, the 5th intercostal space. Okay, I have found it. So now I'm going to put it on the diaphragm and listen for a whole minute. Okay, normal sinus rhythm, no murmurs. And I'm going to flip it to the bell, and I'm going to do the same thing on all of those spots again. And this lets me listen to those lower pitch sounds. Again in the Z pattern. Okay. The heart sounds are clear. It's a normal sinus rhythm. And now can you lay on your left side for me? This kind of allows the heart to get closer to the thoracic cage, so you can hear the murmurs a little easier. And still on the bell, I'm going to put it right on the apical pulse again. Listen for a minute. I hear no murmurs, the heart sounds are clear. So now you can just lay on your back And lift up her shirt for me. Okay. I'm assessing the abdomen, so I noticed that her stomach has a nice flat profile. She has a piercing on her abdomen, or umbilicus. The umbilicus is midline. I noticed a tattoo right there on her, under her left breast, right where the apical pulse would be. Okay. I'm going to listen for any bruise in her aorta, in the stomach area. Right under the ribs here. With the bell again. I hear no swishing or turbulence, so that is clear. Okay. I'm going to also take for bowel sounds, starting in the right lower quadrant. I'm going to listen for about 15 seconds in each quadrant. I should hear about 3 to 5 sounds. Okay. Bowel sounds are normoactive. Okay, now I'm going to palpate her stomach. So I'm just going to do light palpation first, starting in the same direction, going clockwise from the right lower quadrant, about 2 centimeters deep. I'm looking for any masses, any tenderness. Do you have any tenderness right now?
I don't.
Okay. And then the same for deep palpation. So it's going to be about 4 centimeters. You can feel the edge of the liver there. That's normal. I shouldn't be able to feel anything else on deep palpation. Okay. And I should have percussed before this. So I'll percuss. That's not in the right order. So I'm noting tympany in most of the quadrants except for the right upper where the liver is. There's going to be dullness. Okay. That is good. And I'm going to move down to the lower extremities. So I'm looking at her legs. I notice they're symmetrical. Do you shave?
I do.
Okay, so her hair distribution is fine for the fact that she shaves. I'm going to check for any edema. So I'm going to press down in the pre-tibial area for about 5 seconds. Okay, there is no pitting edema. And have you had any swelling lately?
I have not.
Okay, no swelling, no edema. That is good. I'm going to test the dorsalis pedis pulses. Okay, they're +2 bilaterally. And then I'm going to go to the posterior tibial pulses. They're about +1 bilaterally. They're a little bit harder to feel. Okay, and do you mind standing up for me? I'm looking for any varicosities. I don't see any raised veins or blue markings. Okay, lay back down for me. Now I'm going to check for the strength in the feet, so I'm going to press up, and you're going to resist me. Okay, resist. Okay, I think that concludes our health assessment for today.
Okay.
Thank you for coming in.
Thank you.